With schools closed and people asked to work from home if they can, life marches on for other businesses, including childcare centers, who are doing their best to keep a safe environment for kids during this healthcare crisis. Fox 12's Simon Gutierrez is live in Northeast Portland with how they're handling the ever-evolving situation. Simon?
Yeah, by evolving themselves, as you know, a lot of first responders, healthcare workers, and others still need child care in order to go to work. That, of course, means some child care centers are having to stay open in spite of some of the challenges that involves. Today, we caught up with one daycare owner in Central Oregon over FaceTime to talk about those challenges. Sending us video and pictures with her phone, Ruth Cromer is trying to find the balance between keeping the doors open and keeping the virus out.
We are doing a lot of sanitizing.
And their best to practice social distancing, even though it feels a little strange.
Our infant toddler facilities, we're using high chairs outside. So the teacher kind of stands on the backward arm's distance away from the high chair and the student strapped into the high chair by their family. And then from there, the parent backs away, and then we can unstrap the child and take them into the facility.
The families she provides care for are almost all essential workers, some in health care, some first responders. Even with all that, how safe do you feel continuing to operate?
We just feel blessed to be able to serve our community. It's just kind of like doctors and nurses. You know, you just have to have a different mindset.
Although Oregon's governor has ordered schools to close until the end of April, child care centers are allowed to stay open, even though children can catch and spread COVID-19.
Child care providers are making decisions for themselves about whether they are choosing to stay open or to close. So their own safety needs to be paramount, that of their staff, that of the children and families in their care.
Miriam Calderon is Early Learning System Director for the state of Oregon. She spoke with us via teleconference.
Would it be safer to close these child care centers to stop the transmission of this virus?
That is not a guidance that we have received from our public health authorities.
Recognizing the need for continued child care, the state has sent out guidelines for providers, encouraging best practices for cleaning and social distancing.
All of our toys are being cleaned after each child. And then we're only keeping a third of our toys out and accessible to students. That way we can ensure that materials are clean and rotated.
Cromer says she's lost 2/3 of her families who have opted to keep kids home. She had to let go of some staff, at least temporarily, but she doesn't plan on closing her doors.
Just like the doctors and nurses, we have to just say, here I am and I'm available.
Now, more than 24 organizations have sent a letter to Congress asking for emergency funding in order to keep the child care industry going. Obviously, child care workers aren't the only ones still working during this health crisis. Food service and grocery workers also still on the job. Coming up in about a half an hour, we'll tell you what the state is asking those workers to do in order to help stop the spread of COVID-19. Reporting live in Northeast Portland, Simon Gutierrez, Fox 12 Oregon.